Coming up on Mountain News this morning, we talked with a Pulaski County man who is recovering from COVID-19, and he has a message for Kentuckians. And staying in Pulaski County, emergency services are urgently reminding people to not abuse their services amid COVID-19 fears. And here in Perry County, the city of Hazard is showing healthcare workers how much they are appreciated for their efforts to help fight the novel coronavirus.
Dedicated to Eastern and Southern Kentucky, this is WYMT Mountain News This Morning.
Good morning, I'm Katie Cook, and it is Tuesday, March 31st. Your time is about 5:01. Let's check in with Brandon Robinson for a look at your forecast this morning. Brandon, we made it through to the end of March. Tomorrow is April 1st, and you know, other than today being a little bit cooler, we're really seeing those spring-like conditions, and I am loving it.
It's going to be a cool day for sure. Redbud winter in full effect, and we're going to see some of that thing we're tired of seeing. But at least it's a limited time event today. Let's take a look and see what's going on across our region. 6 hours on the last 6 hours rather than satellite radar. You see some of that green trying to show up. Now again, you see it pop in there. Now down toward Lake Cumberland, I think that is some rain, but I think it's going to take a little while before the bulk of that gets here, but it could be a little later this morning. I think most of us make it out the door dry, but you make sure you take your rain gear because you'll need it later today. Temperatures in the 40s and 50s right now. Those 50s are going to be a thing of the past today. I think we top out in the upper 40s for everybody once we stabilize. See those winds coming there out of the north. That's going to push some cooler air into play. A normal day for now on the coffee meter. We might have to go back up to a little extra a little bit later on, but the out the door forecast, you see a lot of temperatures right there in the same range all the way throughout the daytime hours. 48 your daytime high. I'll talk about the rest of the forecast coming up here in a little bit. Katie?
All right, Brandon, thank you. 480, that is the new number of confirmed COVID-19 cases in Kentucky. There are also 2 new deaths. Yesterday, the governor announced an executive order for restricting travel out of state. You should only leave Kentucky if it is absolutely necessary, like for work, to take care of a loved one, or for your own health. We also learned a staff member and resident of a Northern Kentucky nursing home tested positive for COVID-19. So here is the latest map of Kentucky showing COVID-19 cases. There are now cases confirmed in more than half of Kentucky's 120 counties. Here in the WYMT coverage area, there are positive cases in Pulaski, Boyd, Breathitt, Martin, Laurel, Lawrence, McCreary, Rockcastle, and Wayne counties. One new case was announced yesterday in southeastern Kentucky, and that case was in Laurel County. Well, Pulaski County remains one of the parts of our viewing area where we are seeing the most cases of the novel coronavirus. 3 Sundays ago, a woman with the virus went to church. 40 people self-quarantined after that. Yesterday, WYMT's Connor James talked to one man who got the virus. Stephen McDowell said about 6 days after the service, he started showing symptoms. Last Monday was when he tested. He was immediately diagnosed with pneumonia. Then 2 days later, the test came back and he did have the novel coronavirus. Now he has been at home through most of this. He's 47 years old and does have a couple underlying health problems such as high blood pressure and diabetes. So he says some of the symptoms have been pretty rough on him.
The worst thing is not being able to breathe. By far that's the worst, and that's the scariest when you cannot catch your breath and there's no reason for that. You know, they're not winded for some reason. A lot of coughing. At times, you can't even speak for the coughing. It's just continual, on and on. And then you'll have moments like this where, you know, it's not really affecting you. So it's very much a roller coaster ride.
Now his fever is starting to lower and he thinks he's slowly making his way to the recovering end of the virus. But his main message now is to stay in and follow social distancing because this is something to take very seriously. People with the Southern Kentucky Emergency Medical Service are reminding others to not abuse emergency services, especially when they could be stretched thin. Medics in Somerset say people are calling for COVID-19 tests. They're reminding people that these tests are not readily available and that first responders do not have them on hand. Medical professionals at hospitals have them, but only give them to people who show symptoms. Officials say because of the influx in these types of calls, they can't respond to other emergencies.
It has changed our method of treatment a little bit because, like a nebulizer for respiratory problems, it increases the risk of the providers being infected because of the aerosolizing producing in a small area like the back of an ambulance. So unless it's really needed, then they'll hold off on that until they get to the hospital.
The chief says if you think you have COVID-19, call your medical provider, not your EMS service. Well, just across the Pike County border in West Virginia, the Williamson Memorial Hospital announced it is shutting its doors amid the COVID-19 panic. The hospital, which was already in the midst of bankruptcy, says all potential buyers pulled out because of the virus outbreak. At last check, West Virginia has 145 total cases. Well, many healthcare workers across the country are pulling long shifts as the coronavirus battle rages on. In Hazard, the city and county flew a banner with green letters that read, "Thank you all healthcare workers." It was just one way to show appreciation to those battling every day.
When you have acts like this, it means a lot, and I'm sure that these people that are coming off 12-hour shifts are coming on to 12-hour shifts with all these changes. Just appreciate knowing that people are thinking about them.
City officials kept the sign up all day yesterday for all ARH workers to see. The CEO of Louisville-based Yum Brands is not taking a salary for the rest of this year. The Courier-Journal reports that David Gibbs is doing this in response to the COVID-19 pandemic. The money will go toward bonuses of $1,000 for general managers of the 1,200 restaurants the company owns. Yum Brands is the owner of KFC, Taco Bell, and Pizza Hut. And the Louisville Courier-Journal also reports that insurance giant Humana is waiving costs for treatment related to coronavirus. The cost waiver will apply for enrollees of Medicare Advantage plans, fully insured commercial members, Medicare Supplement, and Medicaid. Well, thank you for getting your day started with us here on Mountain News this morning. Coming up, many restaurants have changed their services to comply with new social distancing restrictions. But one in Williamsburg did not get to open at all, and we talked to the owners.
Get the rain gear back out today. You're going to need it. I'll tell you for how long in about 3 minutes.